Thank you. We are very, very lucky to have such a rich panel. And I'm going to ask Eric to just come and present about your vision about how drone has the potential to disrupt supply chain in general. So you can go over there.
So, good afternoon, everyone. As Olivier said, I'm Eric Peck, and I'm the CEO of Swoop Aero. And I'm going to talk to you today about how we can transform the healthcare supply chain with drone logistics. And that is Swoop Aero's purpose. Our purpose as an organisation is to give organisations access to the air and transform the healthcare supply chain with airborne logistics. Olivier's already introduced me, so I won't do this, but that was me a couple of years ago. I started off my career in Australia in the Royal Australian Air Force. I was a captain on the C-130J. I did everything around the world from humanitarian assistance in Southeast Asia through to several tours flying in the Middle East on combat missions. I left the Air Force, I did an MBA, and I worked at a management consultancy firm. And I went to an event one day, and I got asked a question by a government representative in Australia. And the question was, could a drone be used to transport chemotherapy medication in regional Australia? And so I sat back and I thought about that, and generically the answer is yes. It's technically possible to do once. But the real question that had to be answered, what does the aviation system look like to make that possible safely, reliably, and sustainably every day of the week? And so with my co-founder, Josh, who's a mechatronics engineer, we started Swoop Aero in 2017. I'd like to explain to you a little bit why we're really passionate about what we're doing. I'm going to tell a story. And so this is Nurse Marie. Nurse Marie is runs a healthcare centre in a village called Port Kwimi on Epi Island in Vanuatu. Vanuatu is an extremely remote group of islands in the middle of the Pacific Ocean. And one morning in March, Nurse Marie had a problem. A mother had just given birth at a village 50 kilometres away on the southern tip of the island. She immediately needed a dose of a drug called oxytocin, but the only available source of that was at the head hospital on the island. So Nurse Marie called Swoop Aero Operations at about 9 o'clock in the morning. And she said, can we do an urgent delivery to the village? We said yes. And about 25 minutes later, the aircraft that you see there in the picture landed just in front of the healthcare centre, and Nurse Marie was administering a life-saving dose of oxytocin. And that's important because the only other alternative was a 9-hour overnight boat ride back to the village. Now, Nurse Marie isn't alone in this problem, actually. Over half the world lacks access to basic healthcare. And 100 million people are pushed below the poverty line because of the cost they incur to receive healthcare that a lot of people take for granted. And a core reason this exists is because ground transport all over the world is broken. Here's a photo from the DRC from when we were there last year. Here's a photo from, I believe that's Mozambique. Here's a photo in Indonesia. But actually, this is a problem everywhere, including in Australia. And it's because the cost to transport medical supplies is actually more than the cost to deliver them. Now, if you look at the World Health Organization and what the work Gavi have done over the previous 10 years, it now costs more to transport a vaccine to the point of use than it costs to buy that vaccine, which is a big problem. And so we at Swoop Aero believe a solution is safe, reliable and sustainable air transport using drones to augment the current logistics model. And so when we set about building this, a lot of people see, what you can see on the screen behind you, and they think that's what a drone is about. I want to draw your mind back to something else. That's Qantas, the Australian airline. I've naturally felt a bit patriotic and had to put it on the screen there for you. But when people think of a drone, they often think of a vehicle. And when you see that picture there on the screen behind me, you think of an airline. And that's because an airline is a complex aviation system. And actually, they've been around for over 100 years now. And so the way to make the system sustainable and safe and reliable is to take what we already know, improve it with technology, and implement it in the supply chain. And so that's what we've done at Swoop Aero. We took essentially the aviation system that surrounded a Hercules transport aircraft that myself and 3 other members of the team flew in the Air Force. And we brought that down into a 70,000 kilogram aircraft and to a 15 kilo autonomous aircraft to do medical deliveries. And that's very unique because our point of difference in the market is that we've built an autonomous air transport system, not just a drone. And we've done that because that's what's needed to actually integrate this into the market. And so what that actually looks like is a fully integrated aviation system. And we comprise that of kind of 3 different components there. The first one being people. So every system, no matter how much the level or how big the level of autonomy you get, is going to have people in the system. So for the time being, we're going to have pilots that fly the aircraft at one aircraft, 2 aircraft, 3 aircraft to 1 pilot. We're going to have maintenance staff that have to do maintenance because no matter how much we refine this product as a piece of technology, it's going to require maintenance. And how do we know that? Because aviation has been around for 100 years, cars have been around for 100 years, and they require maintenance. We're going to need ground operators to interact with the aircraft, onload, offload, payload. And lastly, we're going to have to train and sustainably manage the training level of the healthcare staff who interact with the system. The second bit of the system there is the processes. Now, this is the boring stuff. This is risk management plans, it's operations manuals, standard operating procedures, a regulatory framework at the back end which allows us to work with regulators everywhere in the world. And actually, rather uniquely, we have a globally unified set of operating procedures that we've deployed and had validated by regulators in 5 different countries around the world. And we do BVLOS in 4 of them. The third piece of that loop there is the technology. One component of that being the aircraft, the thing that most people see in the background behind you. But actually there's other stuff that goes with it. There's supporting infrastructure. There's communications architecture. There's a UTM, or an air traffic management platform, that sits at the back end. There's a cloud-based analytics platform that enables us to manage maintenance as cost-effectively as possible. And so this whole system is designed to be safe, reliable and sustainable from day one, so that you can provide an aeromedical logistics service, something like you see behind me there. Now, we're not really good at marketing at Swoop, so I'm just going to put on a rather raw video behind you, and it's almost a single take end-to-end of a delivery flight. So when you're thinking about a safe, reliable and sustainable system, you have to think back about what we've actually designed and what has to be deployed in the logistics framework to make this possible. So we've got the aircraft, a piece of hardware that's sitting behind you. We have to have multiple reliable and resilient C2 links that we can work anywhere in the world. We can't rely on ground infrastructure because if there's a weather event or a humanitarian event which takes out the local 4G network, we still have to be able to fly. And so we don't rely on any terrestrial networks at all to be able to fly. The aircraft itself has been designed to be fully supportable in the field. In fact, every white component on there you can see, we 3D print. And we do that because I have 9 years of experience in the Air Force needing a spare part in a far-flung corner of Southeast Asia or at a dirt airstrip in the Middle East and not being able to get that part for 4 days. And a healthcare system or a supply chain can't afford that delay. It's made to be cost-effective and sustainable. So that unit you're seeing there is generally 5 to 6 times cheaper than anything else we have on the market. We don't sell them, but we do provide a service with it. But being able to provide a service that governments anywhere in the world, from Australia to the Congo, can actually afford is vital to make this solution be able to be integrated into the supply chain. So reliability is a very important feature. And so what we have to be able to do is provide a service that is trusted to be able to fly every day of the week. And so that's what we've built behind us. You can see this is a human-centered design vehicle that the healthcare staff can learn how to operate in more or less under an hour. And we've deployed this in several different countries that I'll talk about in a minute. But it's a pretty standard system that you're seeing there behind me. So what you're seeing here is a video from the northern part of Malawi, and Ashley's going to talk about that a bit more, so I'm not going to touch on that too much. But the system itself that you're looking at is fully autonomous. It has every decision that it makes airborne that a pilot would normally make, we risk manage on the ground and then program into the computer so it makes that decision before we even have to do anything. From a healthcare worker's perspective, they get a text message when it's 5 minutes out. It comes in, it lands outside the healthcare centre. They walk up, they offload payload, they onload payload. They look above them to make sure the sky's clear, and then they can initiate an automated launch. Now the third part of this third part of this solution we've got here is that it needs to be sustainable at scale. So we've seen all over the world people doing 1 or 2 drone flights at a time, or they can do 1 drone flight a day and there's many, many delays, and a lot of things don't work. But actually, that's not a particularly sustainable and scalable solution. What we need to be able to do is deploy this technology at scale to service 10, 20, 50, 100, 1,000 sites within a network. And so making that move from 1 pilot to 1 aircraft to 1 pilot to many aircraft is an essential part of that puzzle to get to a scalable and sustainable level. So what you're looking at there behind me is a screen grab from our operation in the Carter Bay in the northern part of Malawi, where we're enabling the USAID Global Health Supply Chain project to access the air and facilitate aeromedical logistics within the sample pickup and medical supplies delivery market.
2 minutes.
So what are we doing into the future and where have we deployed this? So you've heard about Vanuatu, and Olivier's talked a little bit about Democratic Republic of the Congo, where we kicked off our initial pilot program last year. And in the next couple of months, we're going to be launching a network to enable VillageReach and the Congolese Ministry of Health to facilitate medical supply to up to 100 villages in the Bandaka province, or in the Equatorial province of Democratic Republic of the Congo, with aeromedical logistics. And this will be one of the biggest aeromedical logistics two-way in the world, and it will be the biggest two-way aeromedical logistics in the world, being a very unique thing that we can pick up samples and bring them back. We've also launched 2 networks in the Republic of Malawi, obviously one supporting and enabling the USAID Global Health Supply Chain project, and a second one supporting UNICEF and the UK aid-led project for sustained multi-role operations, combining disaster response and disaster preparedness mapping with routine delivery schedules. And that'll mean that we'll have 3 hubs across 2 networks operating in Malawi this year, deploying the service that I've just talked about behind me. The key takeaways being that if you design and you build a safe, reliable and sustainable aviation system, you can deploy that into a logistics network and enable a transformation of that service. Thanks very much.
Thank you, Eric. And we're going to take some questions after all the presentations. So just write down your question. But I think this was very interesting how you were able to leverage your career as a pilot in the military logistics, and really transverse that to an end-to-end drone logistic service. So very interesting. Next, Ashley. Thank you.
Thank you so much, and thank you everyone for being here. I work for a USAID project that I'll talk more about in a moment, but we've talked a lot this week about what we can do with drones and why we want to do them, and I really want to get more into the how, the day-to-day how. So I'm going to walk us through preparing for a drone intervention in a supply chain, what assessing readiness for that looks like, and then operationalization and some of the lessons learned from the Malawi activity. So again, that project, it's a mouthful. It's the Global Health Supply Chain Procurement and Supply Management Project. We'll just call it PSM. And PSM had a really unique opportunity in that 3 years ago, we were given a pool of funding for a drone intervention somewhere in last mile distribution in our global health supply chain, but we weren't told where. And we weren't given a specific use case. So we started from the end. We started by looking at our objectives and figuring out what it was we wanted to achieve. I just want to draw your attention to a couple things. You can read these on your own, but we knew that we wanted to have an activity that moved beyond testing for 2 weeks, 3 weeks, and we wanted to have something that spanned several months so that we could capture operational inputs and costing inputs that really you can only tell from a sustained operation. We also knew from the beginning that we wanted bidirectional flights, and I will tell you why that is. When we started looking for this place of performance, we were able to choose from many, many countries. The PSM project procures and delivers medicines to 65 countries around the world, just this one project. So we began looking at those 65 countries. Where do we want to operate? From there, we looked at where we have a field office presence, and we thought that it was very important for us to have a field office presence, not just as Chemonics, but specifically as the PSM project, where we had a supply chain footprint. And that narrowed it down to about 35 countries, and that's not just in Africa. From there, we looked at the disease areas that we work in, and PSM works across 4 disease areas, which are HIV/AIDS, malaria, maternal and child health, and family planning. And the funding that we got came specifically through the President's Emergency Fund for AIDS relief. So we knew that we wanted to look at PEPFAR priority countries and to have an HIV/AIDS focus, but that we also wanted to have applications crossing these disease areas. So when we looked at all of these factors, we started looking at regulations, we started looking at our footprint on the ground as a company and as a supply chain. We ended up doing assessments in 4 countries. And ultimately did select Malawi, and that had a lot to do with our field capacity. Before we designed the activity, what goes into designing and assessing Malawi for the activity we wanted to implement, we did a lot of desk research and a lot of informational interviews with people that were in the country. There are lots and lots of sources of information that you can look at to inform the design of a supply chain intervention at this stage. So these are coming up in no specific order, and they're from different countries, but because we have supply chain offices, we have maps of where the health facilities are located. We could start to look at hubs of operation that our field offices indicated as large distribution centers and sort of map out via an expected flight radius where we might be able to service. We were able to look at health facilities, again suggested by our office, plot out the distances to the district hospitals that supplied them or the next level upstream in the supply chain, and look again at the kilometers and if we expected to be able to service a large number of facilities. We could look up maps, both topographical maps and airspace maps. In the case of Malawi, where we did eventually settle on implementing this project, we leaned heavily on UNICEF to get information as they helped to facilitate with civil aviation the corridor in Malawi. So they gave us a lot of insight before we ever set foot on the ground in terms of designing the project and on what the operating environment would look like. Okay, so once we decided where we wanted to operate, we had to look around Malawi, and we had to say, where is the best use case? And if you're going to implement in a supply chain, it's important to identify a clear and compelling use case via a supply chain assessment. By that I mean it's important to look at where your base of operations is going to be and look both upstream and downstream in the supply chain, because both of those elements are going to be affected. So for example, we knew we wanted to do bidirectional flights because our funding came through PEPFAR, which is an HIV/AIDS funding agency. And so we knew that we wanted to be able to collect lab samples and deliver test results. And we wanted to speed up sample collection time. But you have to be able to parse out what are the bottlenecks in the supply chain that you're looking at? It could be demand management. It could be maybe the lab that processes the samples are stocked out of reagents, and that's because the reagent is stocked out at the central level. And as Gabo mentioned earlier, those problems can't be solved with the introduction of a drone. So you have to be able to parse out the timeline that you're hoping to impact, and which of those challenges can you really impact by introducing a drone. So also, before going in and during the design process, it's important to know all of your stakeholders, and I think that's not as obvious as it sounds. It's quite obvious that you need civil aviation, who in Malawi has been amazingly supportive and helpful, and it's obvious that you need to talk to other ministries. If you're working in health supply chain, you need to talk to the Ministry of Health. But it also is necessary to know how decentralized or centralized authority is, so that you know at which levels you need to get approvals, who you should really be engaging with, and how you should be engaging with them. And make sure you know the answers to these questions during the design phase, so you know that you can have a successful implementation. Is the approval process actually documented? Do you know the timeline, the time that it would take between approval and the ability to roll into a project? I said logistics here, I kind of mean operations. If you don't have a footprint on the ground, if you don't have an office in the community where you're attempting to implement a drone intervention, first of all, what are you doing there? Get some local partners. But second of all, how are you going to answer these questions? Just the day-to-day, where are you going to look to recruit? How are you going to manage your contractual relationship with them if you don't know the labor laws? Where are they going to stay? How are they going to get around? How does seasonality affect each of the locations? So these are all things to be looking in, again, during the planning and assessment phase. I'm going to switch to walking you through startup and some of the steps that we went through to operationalize and integrate into the supply chain. So there was, obviously you have to get the equipment in, you have to import it, you have to do inspections, demonstrations. In Malawi, that happens in the corridor. But a lot of other things were happening for us at the exact same time, and I do recommend that these activities happen in parallel. We were finalizing our staffing, looking at what local support we needed to run effectively. We were starting to bring them on board and to train them, and getting these parallel certifications we need, like dangerous goods certification. We knew that we wanted to carry some HIV/AIDS-focused health products like dried blood spots, and that's not a dangerous good. But again, we work across these 4 disease areas on PSM, so we wanted to carry TB samples, and that does fall into this classification. Or if you need to get night flight approval, anything like that happens during this time. 2 more elements to start up that I want to talk about are community sensitization and comms. And for community sensitization itself, there's 2 really important pieces I want to get across. The first is that this really needs to be carried out by local partners. It was really important to us. UNICEF helped coordinate this. The Ministry of Information and Communications Technology in Malawi actually led it. So who am I to come into a community and extol the benefits of drones that I think the supply chain can benefit from? I really needed someone with authority, someone steeped in the culture. I needed Malawians to talk to Malawians. And the second thing about community sensitization is that this absolutely must happen at the beginning of a project, but it absolutely must continue throughout the project for a number of reasons. And we've found that even several months into operations, sensitization efforts have continued to be important. In terms of the communications, this is a huge part of integrating into a supply chain. You have to talk to the pharmacy staff, the laboratory technicians, and you have to know when you put communications in place, what information do they need in order to receive that shipment, just like they would need information if they were getting it by truck or motorcycle. Do they need to know what type of sample it is? Is there a special handling requirement for it? And build that all in from the very beginning before the very first flight. So this is our timeline of operations, and I put it up here to give you a realistic view of what startup and operationalization looks like, because I work for PSM, which is a USAID project, and I talk to many missions around the world who are rightfully very interested in drones for their supply chains, but they want it yesterday. And if that can't happen, then they want it a month from now. And I have to tell them, this is really complex, and I need people to understand realistically, to do things right, it is gonna take time. So you can see on this timeline, it took us months to hit different milestones that we were hoping to hit. Again, we knew we wanted a multi-month activity. We aimed for 6 months, and we will be wrapping up at the end of February, which made it 8 months of flight operations. So this is the readout, the data. It's not quite current, it's through the end of January. You'll see that the way that we're reporting out on our cargo is very HIV-centric, because that's what our donors are most interested in seeing. But I want to point out that in addition to viral load, early infant diagnosis samples, that we did also carry other products in other disease areas like sputum samples, and we did carry vaccines, we did carry equipment, we did carry medicines, anti-malarials. So we're really pleased with the amounts of productivity that we've been able to get out of this, and the communities are really very appreciative of the impact that it's had on supply chain. And we're working on reporting out both on the improvements in health outcomes that's come out of this, and then also how much of the change we've seen in sample turnaround time can we attribute specifically to drones, because it's still not immediate, because there's still a need to process them, and we can't control what happens at the lab. 2 minutes. So I want to leave you with some recommendations for For operating a semi-sustained operation in the future, again, this was 8 months, so it's a pretty long period of time compared to a lot of what the industry has been able to do in the developing world. And so we've seen things pop up that didn't necessarily come up or wouldn't necessarily come up if you were only operating for, say, a month. So a few thoughts. One, getting buy-in from the facility and making sure that it's genuine. I mean that as separate from facility heads or facility leadership, hospital directors, the people that are actually going to touch your operation, you have to talk to them very early on, because I think we know it's very easy for someone in authority to tell their staff, do this because I want it done. But if you are expecting to add to their workload, you need to make sure they're on board. The community relationships, I think, is fairly self-explanatory. Comms protocols are important in that day-to-day and flight-to-flight manner that I mentioned before, but also in terms of incident reporting. You have to have these protocols in place and make sure that everyone on the team knows what needs to be reported and when, what are the legal requirements, and also ethically, what are you required to report on. Communications, in fact, was somewhat of a surprise for us. It's one of those challenges that didn't come up until, say, month 3. We knew there would be power challenges at these very remote sites we're servicing, so we knew charging the drone would be an issue, but we didn't necessarily think, okay, what happens when people's cell phone batteries die, and then they can't confirm that the landing area is clear? What happens when they run out of data credit, and so they can't talk to us on WhatsApp? So things that really need to be thought through, even though it sounds small. All facilities are different and need to be approached uniquely, even in the same region, even with the same products. And so they all need to be looked at in a unique way. And then finally, knowing from the beginning what is going to happen when the period of performance of the activity ends. So again, from a supply chain perspective, we don't believe that drones are going to replace all forms of health commodity distribution, and so we were careful from the beginning to not disrupt any of the existing channels in the supply chain. We focused on communicating the need for emergency deliveries and supplementing distributions in between the regular distributions in Malawi, which are monthly, so that as we're wrapping up and being able to report on all the things that we're learning, the supply chain doesn't have to reorganize itself again, and there's no gaps in delivery. So I will leave you with that. Thank you so much for your time.
Thank you, Ashley. Great examples of the complexity of the system that needs to be in place before you even start flying. Thank you. Catalina?
Sure. Is this on? Can you hear me? Sorry, I'm going to speak from here because that podium looks huge. So it's not made for short people like me. Can we begin the slides? So what I'm going to speak about today is about the case for integrating UAVs into health supply chains. So the first disclaimer is I don't come from a health background, I come from a transport background, so bear with me if I say something that is not correct. But when we started organizing the African Drone Forum with the government of Rwanda, we realized that there really wasn't enough evidence of the cost benefit of these use cases, of integrating drones into the use cases. We hear a lot about medical good deliveries, land mapping, agriculture and infrastructure inspection, risk assessment, food aid delivery applications, but we really haven't seen a lot of numbers on the cost and benefits of integrating drone technology. So we went into understanding and going in depth in these 5 use cases. For the purpose of this panel, I'm only going to speak about the medical good deliveries one. But before we dive into it, I want to acknowledge our partner in this use case, which is GSI, Naomi Matiko. I don't know if you're here. But they've done all the groundwork for this case study and the upstream work. So excellent partner. Thank you very much. So the 3 key questions that we sought to answer with this study are, what is the most effective use case within the medical deliveries use cases? Which one is the most cost-effective for the particular region that we were looking at? The second question we had is, what kind of OD pair makes more sense? Is it like the really short flights that you can do with a motorcycle? Is it the very long ones that maybe you're going to need a boat and you're not going to need a bus? Is it the medium distance where UAVs are better? So that's another question we try to solve. And then finally, how many drones or flights are required under each of these use cases. And then, towards the end of this analysis, we landed in a point of disagreement in which we couldn't agree on the cost, on the appropriate cost of the drones. And we realized that for the same capacity and the same payload and the same ability to cover distance, there wasn't a clear number that popped out. There are Chinese drones that are at the 10,000 level range, and then you have the 75,000 European drone and everything in between with similar, at least for a first year of operations, performance perspective. So what we did is we added a fourth question, which was about trying to get to what is the break-even point? What is that point at which the user, let's say the client, or can be the government, can be the private sector, is indifferent between doing the services with the traditional transportation versus drones. And we've heard about, in this panel actually, Gabby, she said like, it's not about replacing, and yes, it's not about replacing, but I think it's a good starting point to go in depth into understanding the costs of both modes. So, yeah, so our study focuses on the Ukerewe Islands, which are in the Lake Victoria region, and the south of the Lake Victoria, which is the northeast part of Tanzania. And we picked this because we believe it's representative of similar challenges in the region, similar distribution, similar geography, and similar transportation challenges. Actually, in this particular area of the Ukerewe Islands, there are more than 300 health facilities, so also a very dense location of health facilities. And these Ukerewe Islands also present very important logistical distribution challenges, and these challenges come from many fronts. Public transportation is very unreliable. People have to rely on small boats, on ferries that are always not on time. There's not a lot of full year, all-weather roads. There's also, so there's a number of reasons why these logistical distribution challenges are happening in the Ukerewe Island. Again, we believe it's representative of the region. So I know it's late, and some of you might want to leave, although I encourage you to stay for the other presentations. But these were the findings of our study, so I'm going to start with that. The first one was that when you look at medical goods categories individually, what you will find is that it's always more expensive to deliver by drones versus the traditional transportation. And this is not surprising to many of you, I imagine. The second one is that when you start layering use cases, you can provide efficiencies and cost savings because you're able to allocate the fixed cost of the drone and the drone operation center to a big number of flights, and then you're able to maximize the utilization of the drone. The third finding we had is that we arrive at that number, and I'm afraid to say a number because numbers are very sticky, but we arrive at that capital cost where we believe that there can be indifference between doing the delivery by traditional methods of transportation versus via drones. And here I want to be very careful because the apples to apples is probably not the good way to look at disruptive technology. Every time we've done that in history, we get it wrong. I don't want to be like the McKinsey in the 1980s when they predicted how many cell phones are there going to be, and they got it wrong but by 99%, their prediction of the cell phone penetration by 2000 and something. So anyway, I don't want to be this person. I just want to lay some numbers on the paper and start from there. And then the fourth finding is that cost effectiveness of UAVs cannot just be looked at through a cost perspective. There are a number of important health benefits that we also try to document in this study that need to be taken into account. So the finding number one is that when you look at the medical good categories individually, costs are higher to deliver by drone than by public transportation. And by individual categories, we mean essential medicines, emergency orders, vaccines, bloods for transfusion, and laboratory samples. Those were the 5 categories we looked at. And the groundwork here was amazing because to understand how all these 5 different categories of products move through the different systems is not easy. And there's a lot of informality, and there's not a lot of records. So the groundwork to get to these results was amazing. I'm going to give you a few examples. If you look at a routine distribution, sometimes of medical goods, sometimes they go through the hospital, like on the left, and sometimes they don't go through the hospital, but they go directly by truck and by ferry to the health centers in the islands. Or if you look at the emergency orders, sometimes is the prime vendor takes it to the ferry, then the health center employee goes to has to go to the ferry, pick it up, take it on a truck, put it on a boat, and take public transportation. So there's a lot of opportunities in this chain for things to go wrong. Vaccine is particularly interesting because vaccines, as you know, require to maintain the cold chain. So also in this long cycle to go from the regional vaccine store to the health centers, there's also a lot of opportunities for this cold chain to be broken, which obviously damages the effectiveness of the vaccine. Also in blood sample lab transport is also very interesting, and maybe it's because I wasn't coming from this background that I find it fascinating. But apparently, from the moment you take a blood sample to the moment you take it to a health center, you only have 5 hours. And then from that health center to the place where they're going to be analyzed, you only have 5 days. If you go beyond that, the sample is no longer valid. So if you think about all this going from the spokes to the hubs, to the main hubs, to the testing labs, there's also a lot of opportunities for these samples to be exposed to heat, to be stuck in one of these points of connection. So a lot of opportunities for these blood samples to be damaged. And then the last one I'm going to mention is the whole blood for transfusion, because this one is interesting on the apples-to-apples case, because it shows that many of the cases, actually, the blood for transfusion transportation is done for free. So in terms of cost, the drones are never going to be competitive if you just look at cost. So this tells us that, of course, there's another dimension that is much more important, which is the emergency and the reliability and the ability to deliver on time. So I wanted to give all the numbers, but then I was like, okay, no, it's too late. So at the last minute, I threw in this just to summarize a little bit the findings. And it's, as you imagine, the categories with very high quantities, although the cost per flight goes down, the reality is that you need more drones, more capital costs. So the net benefits are zero on savings. The small volumes, like the long tail kind of items, this result in very few flights with very high costs, so also not very interesting. The most cost-effective routes are those that are to distance facilities on the small islands. And there are some use cases examples that, although they're not cheaper to deliver by drones, they are more cost-effective, which are the laboratory samples and the life-saving items and blood deliveries. So the second finding was related to the layering of use cases, because this is a word that we've heard a lot in the last couple of days. What if you layer a lot of use cases? Would it result in more efficiency and more cost savings? And the answer is, of course, yes. And it does so by maximizing the cargo capacity and time utilization. And also, there's another opportunity there to bring more efficiency, which is that with drones, in principle, you should be able to do more the milk run, which is going from health facility to health facility without having to follow the hubs and spokes model, which is less efficient, but is more typical of public transportation networks. So our finding shows that in the Ukerewe context, the opportunity for transport cost reduction lies in layering the following use cases: lab samples with blood delivery, plus life-saving items, plus rabies vaccine, excluding the nearby facilities. And there you go, you can increase by 60 to 80% the utilization of your drone, which would lead to about 30 to 40% reductions in transport costs. So the third finding, which was about that cost of the drone that would make it indifferent to go for drones or for other forms of transportation. The number we arrived at, is between $15,000 and $20,000. And I think this is, of course, this is not definite, and we will review probably this number many times. But I think it gives a signal to the market of what is a price point for the technology that makes it at least affordable, because you're comparing it to the costs that are already being incurred by the government or the client. So yeah, a lot of caveats to these numbers, but that's it, $15,000 to $20,000. And then the last question, which was, what is the health impact of blood being sent through drones as opposed to traditional transport? And here, it's a relatively simple methodology, although there's a lot of mathematics modeled behind it. But basically, the assumptions are that if you deliver blood that is more than 2 hours after you requested it, then it's a late delivery. And the fatality rate of a late delivery is around 90%. And then when the delivery is made on time, there is a fatality rate associated at 5%. I understand, because the blood can also be damaged in transportation, or it comes with lower quality, actually. So this tells us that there is a benefit, a health benefit, that we are not taking into account very often, because we don't know how to quantify it. And then the conclusion from this part of our study is that for the specific case of the Ukerewe Islands, the deployment of drones can reduce the number of deaths by almost 80% compared to traditional transport. And then I'm just going to conclude by saying the following points. The first one is that, of course, as I mentioned, disruptive technology cannot be looked at through a lens of apples to apples, because we don't know how is it going to evolve or what is going to make possible. But we believe this is a departing point. The second one is that there is still insufficient evidence to be able to accurately say, okay, UAVs have a significant competitive advantage. We still don't know. This is a very early industry. The third one is that the results of the study are encouraging, because if in a place like the Ukerewe Island, where the deliveries are made by public transportation, which is very, very inexpensive, and you still can make it equivalent in cost to a UAV at $20,000, then there is a lot of opportunities here. It's quite encouraging. It's not science fiction, as some people might think. And then the last finding is that, or more on the next steps, is that we need to look into more matching the transport technology to the systems that they are supposed to serve. Here we stick to just one type of drone, but maybe there's opportunities there to do better matching. And then the other thing that we would like to work more on is on what are the other opportunities for introducing efficiency across the entire supply chain, not just focusing in transportation, but I'm sure that there are a lot of other opportunities perfect, for introducing efficiency in the system. So yeah, thank you.
Thank you. Thank you, Katarina. Great insight on the costing, but there's always, I like that you lay out strategies to start bringing the cost down, and also emphasize that the cost is one thing, but at the end of the day, like we said earlier on the first day, drones are a mean to an end, and that end is providing equitable access to healthcare. So let's keep that in mind, at least in the health sector. It's really important. Thank you. Abdoulaye and Carla, this is our last talk. Then we'll open for questions. We're doing great on time, by the way. Thank you, guys.
Thank you so much. I'd like to start with a question for all of you. How many of you have thought about what a drone-integrated supply chain system will look like in 5 years? Can I get a show of hands, please? Great. At least there are some of you that have thought about it. So we are very interested. It's gone forward. We are very interested in this, and we're excited to talk to you about it today. I have two key takeaways. One, start thinking now about what it would take to integrate drones into the existing system. And number two, remember that institutionalization is not as much about the solution, in this case, drones. Rather, it's about the entire context. So what do we mean by institutionalization? The process of integrating a solution and transferring it to a government or another partner can be called many different things. It can be adoption, it can be transition, it can be institutionalization. At VillageReach, we usually use transition. At PATH, they use institutionalization. Today, we're going to use them to mean the same thing. And does that mean that the government or the other entity will take on everything? No. In fact, the management, the ownership, and the operations could be taken on by different partners through public-private partnerships. So we're going to start with a case study of a very good solution, one that's not drone-related, but that had trouble getting institutionalized. And we're going to learn from those lessons to figure out how drones can learn from those and how we can move forward. So I will turn over to Abdoulaye. Thank you.
Thank you, Carla. There are two solutions that have helped us learn where the challenges are when it comes to institutionalization. The first project was called Optimize, implemented by PATH, which took place from 2008 to 2011, and it included the introduction of several successful innovations to reduce stockouts rates in the north region of Senegal, specifically the Saint-Louis region. We developed a roadmap 1 year before the project ended. In addition, despite workshops and plans, the government never fully adopted. Based on this lesson learned, we took a different approach with Yexina, the informed push model. The overall goal of the Yexina project was to scale up and integrate the informed push model through eliminating stock out at all service delivery points, SDP, obtain regular, reliable, and current information to manage the health supply chain system. This time, we approached it with having both expansion and institutionalization goals from the beginning. The solution itself was effective. We were able to reduce the stock out rate from 80% to 2.05%. If you look at our original timeline, we plan to scale to all districts by early March 2015, which we did. However, we also plan to transfer the system to Pharmacie Nationale d'Approvisionnement. Pharmacie Nationale d'Approvisionnement means National Pharmacy Store. At the time, PNI was not ready to adopt the project. So we continued to build their capacity and had an official handover on September 2017. Of the many components, human resources and finance proved to be the most problematic. And now the government is evaluating whether the new system has the same quality as before. Through the conversation with government, we learned that the buyer were that IPM took a siloed project approach. IPM dealt with only 11 contraceptive products, while service delivery point received 118 products, and that was the government preference. IPM emphasized expansion over institutionalization and succeeded to expand the project to the entire country in just 2 years. But institutionalization was not focused on as prominently as it should have been. The program was focused on solely public versus public-private partnership model. IPM used private third-party logistics, 3PL, for the last mile distribution. This was seen as a threat for jobs and authority in the public sector by many high-ranking officers within the Ministry of Health. The government wanted to find sustainable financing mechanism. IPM worked alone rather than taking into account the chain of partners. IPM failed to publicly recognize the contribution of other major partners of the Ministry of Health, such as USAID and UNFPA. Therefore, they were reluctant to recognize IPM's achievements and successes. This situation was very uncomfortable to the Ministry of Health. In light of those findings, we held award ceremonies to recognize those involved, hired McKinsey to help the government determine what models were necessary to fund the project in the long run, worked with all partners to develop a detailed plan, and the minister himself made 4 critical notices to help gain the funding needed for the ongoing implementation. In fact, the proposed model created by McKinsey would actually raise more money from the system than the amount needed to implement IPM project. The government is now implementing, but still is evaluating the ongoing quality as we continue to learn from this process. Carla will explain some of the lessons learned and what critical steps can be taken in the future to help make the transition process as smooth as possible. Carla, you have the floor.
Thank you. Great, thank you so much for that amazing solution that you told us about, and also for giving us those challenges. How many of you have dealt with some of those challenges? All right, we've got a couple in the room. These challenges can apply to multiple things, including drones. So the first thing is, in terms of time, they met their targets for expansion. However, it took 3.5 years longer, 3.5 years longer, to reach the point of institutionalization, and still, it's not at the same level as it was in the beginning. Also, there were expectations that the government had that were not being met. And even once they were met, there were still issues with building up the capacity for finances and for HR. So it's important to have the key champions involved from the beginning, not only to understand the solution and to buy in and to champion it, but also to make sure that they have a long-term vision for how to get to sustainability. And then, I'll say it again, but it's not just about the solution. This was an incredible solution. It went from 80% to 2.05% stockout rates. That's incredible. But really, what you need to do is take into account the entire ecosystem. So what does that mean? We've been thinking about it, and both VillageReach and ExpandNet have been creating this framework that really is about what needs to be in place in order to transition something well, and what needs to be taken into account for the political, economic, and social context. This circle that you see is the transition readiness assessment, and really it's just one piece of many processes that are needed for transitioning well. And really you need to make sure that the entity that's taking on the solution has the ability and to make really strategic decisions about each of these critical elements. So, why is this interesting to you? How does this apply to drones? So first of all, for the solution, are we using the correct use cases, the best use cases for drones? Also, do we have the human resources do they exist already for the drones? If not, how do we get them in place? Do the people who are in place, will it affect their jobs? Absolutely. So how will that in turn affect the end user, and how do we get there? Also, do we have the infrastructure needed, and how do we get there for operating the drones and maintaining them? And then finally, for financial management, is there a way to create a sustainable approach? Are there public-private partnerships? And if those exist, and when they exist, does the government have the capability to actually plan for, receive, and then disperse those funds? And if not, how do we get there? In terms of the government strategy, are we answering the questions that the problems that the government really wants to solve? I hope so. And if so, is that in the government strategy? We've talked a lot about this at this forum about policy and regulation. Not only do the policies exist, but do we have the ability to actually enforce them? And how do we get there, and how do we learn from each other? Malawi went to South Africa to learn from them. DRC came to Malawi to learn from Malawi, and we're all learning from Rwanda right now. How do we continue that trend? And then finally, in terms of organization, what government body, what entity is going to coordinate an integrated system? This is dealing with cross-cutting medical commodities when you're talking about medicine. It's also dealing with cross-cutting issues if you're going outside of health. So are the key champions in place not just in individual ministries, but in different departments within those ministries? So I would like to tell you that we've been thinking about transitioning with governments for a long time, and we've been working with governments on it. And there are really 3 key takeaways that I want you to think about, okay? So this is my call to action to you. Number 1, think now. Number 2, similar to that, make sure to start talking now to all the critical stakeholders that are needed to create an integrated system that is sustainable and takes into account the existing system. And number 3, think about how much of your time, your personnel, your costs need to be dedicated to this process. Because if you take all of this into account, it's not going to make transition easy. It's still going to be difficult, I promise you. However, it should be easier, and a sustainable supply chain system integrated with drones that serves the communities at the last mile and helps save lives will be possible. So thank you so much to all the governments, particularly, who have really helped us shape our thinking, to the donors and our partners. And feel free to reach out to any of us, and also to Modibo, who put together the Senegal slides but was unable to make it. Thank you so much.
Thank you, Carla. That really reminds us that we're putting so much work, so much resources into a solution that's going to sustain a year or 2, and then once the implementer moves away, it just doesn't continue. That's not the point. That's not why we are exploring drone. We are looking for drone to be a sustainable solution. So really, from the very, very beginning, start working on how you're going to be transitioning to a local institution, I think is the key. Thank you very much. A round of applause for everyone, please. Thank you so much. And now I'd like to open the floor for questions. So I think we have the ladies in yellow who has a microphone. So go ahead if you have any question for any of the presenter. Maybe I should start then. I'll give you a minute. My first question is for Eric. I'd like for you to answer not as a CEO of Super, but as a CEO of a private sector company, in this case a drone service provider. But can you talk to us about what is your vision as the owner of a company, but please don't make it specific, of the future of last mile supply chain 5 years from now? I'm not talking about so far away that it's like dreaming, but 5 years, 10 years from now. Can you just share your thoughts?
Yeah, definitely. Thanks, Olivier. That's a really interesting question. And I think there's this opportunity here to implement technology all over the world in all different market segments and enable different organisations that are employing that to leapfrog from their current state to an ideal future state they want to achieve. And the technology we're talking about today is an example of that. In terms of working as a private company in this space, the implementation of this particular technology we're talking about, being unmanned systems, has the ability to genuinely create value in that last mile supply chain. And so as a private company, what we're genuinely focused on, and what I think everyone in the room should be genuinely focused on if you're playing with this technology, is actually implementing a sustainable solution to create value. Because ultimately running a private company, if I can create genuine value and genuine sustainable value, that as a CEO of a private company, profits will eventually follow. And there might be a delay in that as the technology is adopted, as you reach scale, as you identify the right use case. But ultimately, that's what you need to do. You need to focus on the areas in which you can actually create value. Projecting forward 5 years to answer that last minute, I don't think we're going to see drone delivery or drone logistics taking cars off the road everywhere. I think it's going to be a new autonomous mode of transport that's going to enable genuine impact and genuine cost efficiency to be realised within existing logistics networks. And so in 5 years' time, I think it'll be an accepted mode of transport.
Thank you, Rick. Any addition from the panelists to that comment? No? Yeah?
Yeah, just a small thing I would like to add is that, I mean, we don't know where the technology would be, obviously, in 5 years. But what I do think is realistic is to imagine that in 5 years, nobody is going to die because they didn't receive their blood of time. I think this is perfectly a realistic thought. And I think it's up also to this group of people and to this ecosystem that we're creating today to make that happen.
Yeah, great point. Thank you.
Any question from the panel? I mean, from the audience.
There's one here, Torres.
Right in the front. Okay.
Thanks for the very interesting presentations, but my question goes to Catalina. She mentioned the price point of 15 to 20,000, but I really wanted to unfold this or break it down if you could. Is it related to the aircraft only, or is it operation? What's the time frame of that price point? Maybe you could please break down that.
Can you give us your name, please?
Totus UNICEF.
Okay.
Sure. So as I said, this number is for this specific case we look at. And it is basically the number that, as an agency, you would be indifferent between doing your delivery of medical services, specific medical services. We kind of cherry pick. And you would be indifferent between delivering with drones or delivering by the current transportation methods. And that cost is specifically capital cost. So it just talks about the aircraft, and it assumes that it is that it would fly 1 year and between 1,000 and 1,300 flights per year. that's kind of where it is.
Can you have 2 more questions, last questions before the wrap up, please? So one over there. Is there another one? There's only one question. Oh, good. Okay. And second one over there, then we wrap up this session.
Je suis Archimède de VillageReach RTC. Je suis très intéressé à la présentation d'Ashley. Alors, la question où j'aimerais bâtir sur la réflexion d'Ashley. Ashley, avec leurs études à Victoria, ils ont montré que le drone coûtait un peu plus cher que le transport de routine. Mais aussi, au même moment, il a montré que pour ce qui est de la réduction de la mortalité liée à l'hémorragie, le drone réduisait jusqu'à 90%, pendant que le moyen de transport le réduisait à 5% de routine. Alors la grande question ici pour nous, au cours de cette assemblée, c'est partant de quels paramètres devons-nous bâtir la décision d'utiliser les drones ou pas? Est-ce que c'est par rapport au coût ou par rapport à la vie ou à des vies à sauver? C'est une réflexion que tout le monde, nous pouvons continuer à le faire. Ma question, elle est celle-ci. Ashley, j'aimerais comprendre, vous avez comparé le drone avec le moyen de routine. Est-ce que vous voulez nous dire quels sont ces moyens? Est-ce que c'est un bateau? Est-ce que c'est une pirogue? Ou quels sont ces moyens que vous avez comparés par rapport au drone? Parce que je pense que ça serait bien spécifique d'un moyen à l'autre. Merci.
Okay, thank you for the question. You were asking about, there were several comments about the value of drones versus the cost of drones, which I think was a very astute point. And first, I want to point out that in our case, and I hope in other supply chain cases as well, that's why we're not only tracking cost, but health impact. I think it's important, I often compare it to a helicopter. When we send a helicopter in a medical emergency, is that cost effective? No, that is not the most cost effective choice, but it is the right choice. And that's why I believe that drones need to be used in specific cases. And then the question at the end was about comparing various modes of transportation. What are the routine modes of transportation that I mentioned? So in Malawi, specifically in the area where we operate, we're servicing islands and also communities that are right along the edge of Lake Malawi that are technically not islands, but they're totally inaccessible by both car and motorbike. So they're only accessible by boat and now by drone. So the difference in turnaround time is enormous for 2 reasons. One, the way to get there by boat is either by a ferry that only runs once a week, if it's not broken, or to hire a private boat, which is really expensive, especially for these health communities that in some cases we've seen they can't pay the electricity bills, so they can't pay $300 to charter a boat in an emergency case. But globally, the routine distribution methods that I'm referring to also include trains, boats, planes, camel in some cases. So there are lots of different ways that we use to get commodities down to that last mile. And I want to repeat what I said before about it. The drone isn't going to be the most cost-effective thing in all cases, and I would say most cases. But that's not what we're aiming for, and we don't think that you can put a price tag on improved health outcomes. So we track both. And thank you for the question.
Last question.
Hi, I'm Marga Eichley from FHI 360. Thank you for your presentations. What I noticed about them is that we see there's a very long timeline for all the preparations that we need to even get to the point to know what use case and in what location we want to attempt to use drones for medical delivery. So far, a lot of these efforts have been funded by donors. My question is, who else is, should, or could be funding this long timeline of preparations to get ready to make this a reality?
Yeah, I'll comment on that, and then maybe if other people have thoughts, they can jump in. But I think that when I look at the supply chain in its entirety, distribution is often a function that is not a core competency for a government supply chain. So often it makes sense for a Ministry of Health run supply chain to outsource that. So eventually, I think this should be a service that that a third-party logistics company can offer, drone companies can offer, so that you can say, I have these distributions, I don't really care how you fulfill them. There are going to be several methods of transportation needed, but I do think that it needs to be the logistics companies.
Go ahead, Katrina.
I would add that, okay, I don't have an answer to your question of who should fund these efforts to get to that point. But I think in the research that we were doing, what we're trying to show is that these costs are already incurred by someone. Someone is already paying for this transportation to go from one hospital to the health facility. Those costs are already out of pocket in someone's pocket. So what we were trying to show is that delivering by drone is actually, for a specific cases, is cost equivalent, is cost effective already. So it's not science fiction. It's not that we have to wait 20 years for delivering by drones to be cost effective. It's already equivalent for some specific cases to the costs that are incurred already by the different parties in the supply chain.
Eric?
So I think there's an interesting thought there around the length of the project implementations at the moment. And if we look at the cycle of innovation that we've gone through using this technology, what we've seen predominantly up until this point is agencies and donors investing in innovation, not necessarily a solution at this point in time. And they're investing in that innovation because on a global level, if we can find a technology and innovate it to fulfill a specific need, we can have a fundamentally life-changing impact on a global scale. And so up until this point, I think we've seen investments made by agencies and funders to catalyse that innovation to have this technology implemented into the supply chain in this context. As we move forward, as a private company, we see our role in this scenario beginning to work more and more with those organisations to run this and to provide this solution as a business, and then making an upfront investment as a business to work with an organisation to identify a use case and implement it. So we're going through that transition at the moment. We've seen in Rwanda, we've seen that happen very well here, and we're going to see that all over the world as businesses come in and we take the burden of implementing or catalysing innovation becomes a private organisation's responsibility to implement a technology. And that's my view on it.
Yeah, actually, I want to add really quickly. I say this knowing firsthand how very difficult it is, but as we're still in this space where donors are still funding projects, and I don't know the answer how this can work out, but we're seeing these, 8-month project here, 12-month project there, 6 weeks here, and I would really like to see donors collaborate and coordinate to figure out where we can pool funds and resources and have the biggest effort. And I wish I had the answer, but let's all think on that at least.
Thank you, everyone. A round of applause for a great panel. Thank you so much.
Thank you very, very much.